Did you know that spotting the earliest signs of cancer can make the difference between life and death? That catching it early can mean your chance of beating the disease goes from less than half to more than 99% for some types? Most people think cancer sneaks up silently, but the truth is, our bodies often give us warning signals long before things get serious. Unfortunately, these signals are easy to ignore, brush off as something minor, or attribute to getting older. I've seen it firsthand: friends, family, even my own patients, letting these signs slide until the disease was far harder to treat. Today, I want to share with you 10 of the most common and overlooked signs of cancer. Please don't ignore these. Your life or someone you love may depend on it. Let's dive in. First up, sign number 1: extreme fatigue. We all feel tired sometimes, but this isn't the kind of tiredness that goes away after a good night's sleep or a day off. This is the sort of exhaustion that lingers, that makes it hard to get out of bed, that leaves your legs feeling heavy and your mind foggy even after you've just woken up. Patients have described it to me as a bone-deep tiredness, the kind that makes climbing a flight of stairs feel like running a marathon. Now, I want to be clear. There are a lot of reasons you might feel tired. Maybe you're working too hard. Maybe your thyroid's out of whack. Maybe it's something as simple as needing a change in your diet. But when fatigue is persistent and doesn't have an obvious cause, it needs to be investigated. Cancer can cause anemia, which reduces oxygen in your blood and can leave you feeling weak. It can also disrupt your metabolism, sap your energy, and even bring on hair loss, weak nails, or heart complications. Don't wait until you're too tired to enjoy life. If you're experiencing unusual fatigue, especially if it's new or worsening,
talk to your doctor. Early intervention can dramatically improve your odds. Sign number 2 is bleeding, something most folks shrug off, but it can be a red flag. This includes nosebleeds, blood in your urine, or blood in your stool. Sometimes the blood isn't obvious. It can make your stool darker, almost black, which doctors call melena. Cancer often grows blood vessels to feed itself, and these vessels can rupture and bleed. This is especially true for cancers in organs with a lot of blood supply, like the bladder, colon, or lungs. If you notice blood when you cough, in your urine, or in your stool, don't ignore it. But there's another side to this coin. Cancer can also make your blood more likely to clot. If you've had a clot in your leg, known as deep vein thrombosis, and there's no clear reason, no broken bone, no surgery, no long period of bed rest, get checked out. Clots can break loose and travel to your lungs, causing a pulmonary embolism, which can be deadly. Smoking increases both cancer and clot risk. Whether it's unexplained bleeding or clotting, don't wait. Seek help. Now, sign number 3 is all about your skin. I want to talk about melanoma, a form of skin cancer that can be incredibly aggressive. Most people think skin cancer is just about sunburns or older folks, but melanoma can strike anyone. What should you look for? Moles that are growing, moles with uneven edges, multiple colors, or that itch or bleed. If a mole is changing, getting bigger, darker, or developing a strange shape, get it checked out. You don't need a dermatologist for the first look. A good general practitioner can help and refer you if needed. Remember, early detection is everything. I can't count the number of times someone has told me they thought only a specialist could spot skin cancer. Don't wait for a referral. Get any changing mole looked at right away. Sign number 4 is unexplained weight loss. Most folks are happy to shed a few pounds, but when the weight drops off and you haven't changed your diet or exercise, it's time to pay attention. Doctors consider a loss of more than 10% of your body weight in 6 months without trying to be significant. Cancer can change your metabolism, sap your appetite, and burn energy as it grows. I've seen patients who lost 20% of their body weight, thinking it was just stress or age. But it could also be diabetes, thyroid problems, or even parasites. Don't wait until you're gaunt and weak. Any sudden, unexplained weight loss should be checked out. Early diagnosis makes all the difference. The 5th sign is swollen lymph nodes. Lymph nodes are small, bean-shaped glands that help fight infection. You've probably felt them in your neck or armpit when you've had the flu or a sore throat. But if they swell up and there's no infection, no fever, no sore throat, no other symptoms, this could be a sign of cancer. Cancers like lymphoma or leukemia often start. Here and other cancers can spread through the lymphatic system. If you notice lumps in your neck, armpit, or groin that don't go away, get them checked. These little glands can be your early warning system. Sign number 6 is progressive pain. Most of us experience pain from time to time, a headache, a sore back, a stomach ache. But what sets cancer-related pain apart is that it gets worse over time, not better. Maybe you've had headaches on and off for years, but now they're coming more often, lasting longer, and requiring more medication. Maybe your stomach pain used to resolve with antacids, but now it sticks around, keeping you up at night. Progressive pain, pain that's intensifying, changing character, or resistant to treatment, needs investigation. It could be a sign of a tumor pressing on nerves or organs. Don't wait for the pain to become unbearable. Early treatment can save lives. Sign number 7 is changes in bowel or bladder habits and changes in swallowing. These can be subtle but important. Difficulty swallowing solid foods or needing to blend meals just to get them down can signal a mass or tumor in your esophagus, throat, or stomach. Changes in bowel habits, sudden constipation, diarrhea, or a shift in how often you go can be a warning sign of colon cancer, especially if there's blood involved. Compare your current habits to your typical routine. If you've gone from daily bowel movements to once or twice a week, or if you're struggling to swallow foods you used to eat with ease, get checked out. For suspected colorectal cancer, a colonoscopy is the gold standard. Don't settle for a simple blood test if your doctor is concerned. Early diagnosis here is critical. Sign number 8 is persistent nausea and vomiting. Cancer can release substances that upset your stomach, reduce your appetite, and make you feel sick. This isn't the occasional. Upset stomach after eating something bad, it's ongoing, getting worse, and not responding to typical remedies. If you're throwing up frequently or can't keep food down, it needs investigation. Persistent nausea can be a sign of cancer in the stomach, pancreas, or even the brain. Don't chalk it up to nerves or a bug if it's lasting weeks or getting worse. Sign number 9 is growing nodules, lumps, or bumps you can feel under the skin, especially in places like your neck, thyroid, or elsewhere. I want to highlight thyroid cancer here. It's becoming more common and, if caught early, has a cure rate above 99%. Most thyroid nodules are benign, but any new lump should be checked. Don't panic if you find one, but don't ignore it either. Nodules that get bigger, change shape, or cause symptoms like hoarseness or difficulty swallowing should prompt a visit to your doctor. And remember, nodules can appear anywhere: breast, lung, skin, or soft tissue. The earlier you catch them, the better. Sign number 10 is persistent fever or increased body temperature, especially at night. This isn't your standard fever from a cold or flu. This is a temperature spike that keeps happening, often at night, and isn't linked to an infection. Night sweats, soaking your sheets even when the room's cool, can be a sign of blood cancers like leukemia or lymphoma. If you're experiencing unexplained fevers or night sweats, don't just wait it out. These symptoms need investigation. Now, you might be thinking a lot of these symptoms could be something else. And you're absolutely right. Fatigue, bleeding, pain, weight loss, these can all have other causes. But when these symptoms are persistent, unexplained, or getting worse, it's crucial to get checked out. I can't emphasize enough, early detection is the key to survival. For example, recent studies show that new blood tests can detect ovarian cancer with 92% accuracy, potentially catching it before symptoms even appear. And while cancer used to be thought of as a disease of older folks, research now shows that early onset cancers are rising in people under 50, particularly breast, colorectal, kidney, and uterine cancers. That means all of us, no matter our age, need to be vigilant. Let me pause for a moment to speak directly to you. I know this isn't an easy topic. It's scary, but it's also hopeful. We live in a time when medical advancements are moving faster than ever. Early detection tools, new diagnostic tests, and better treatments mean that catching cancer early can lead to complete recovery, even for aggressive types like pancreatic cancer. But none of these tools work unless you take action. That starts with paying attention to your body, listening to the warning signs, and not waiting for things to get really bad before seeking help. If you recognize any of these symptoms in yourself or someone you care about, don't wait. Schedule a checkup. Talk to your doctor. Push for further tests if you feel something isn't right. Remember, most cancers are treatable when caught early, and some, like thyroid cancer, have cure rates above 99% if diagnosed before they spread. The biggest mistake you can make is to do nothing. Before I wrap up, let me leave you with an encouraging thought. Cancer doesn't have to be a death sentence. With knowledge, vigilance, and medical advances, survival rates are higher than ever before. You have the power to make a difference for yourself, your family, and your community. By being proactive, you can catch cancer when it's still just a whisper, not a roar. So if this video helped you, don't keep it to yourself. Subscribe now, leave a comment about your experience. Have you or someone you know faced one of these symptoms? And share this with a friend who might need it. Together, we can raise awareness and help save lives. And if you're interested in learning more about how simple lifestyle changes can impact your health, check out our next video on fatty liver disease, another growing concern, but one that can be managed with the right information and choices. Take care of yourself and don't ignore what your body is telling you. See you next time.